offer. I'm very excited to have Cory joining us today. I've reached out to Cory several times, probably within this year, and referred a lot of families. A lot of people have a lot of questions. And so when we were going to do this series, Cory was the first people that I thought of speaking with, because I wanted everybody to have this information so that you can access it. So I just want to let everybody know that I am recording this presentation. So that way I will send an information sheet that Cory has along with this presentation. So that way you can view it later for your reference. Share it with your family members, share it with somebody that in your family that may need this information as well too. And Cory, you'll get it as well.
Okay, nice.
So Cory, let us know what's going on.
Well, hello everybody. My name is Cory Glasgow. I'm a social, as Shannon said, social worker with Caregiver Support. And I've been doing it for a few years. I've been at the VA for eight years, worked in a couple of different programs, the geriatric clinic. I worked in the homeless veteran supportive housing program. And I really like working with veterans. I really have liked so far, and I plan to keep liking working with caregivers here in the Caregiver Support Program. It's kind of a unique program. Most everything at the VA is geared towards the veteran, and this is one of the few programs where really, you know, the whole thing is designed around the caregiver, who often isn't a veteran. We do have some that are veterans as well, but the majority of the people we work with, you know, are family members, loved ones of the veteran. It's a great program. You know, I just to share, before I started working with the program, you know, I like to read, and there was just from experience, you know, caregiving is very difficult. And so I had this kind of preconceived notion where, you know, just how hard it is and how much it can wear you down. And it definitely can be those things. But getting into the program, I started really looking at stuff that the Dole Foundation has done. And it really shed light that, you know, being a caregiver isn't this monolithic thing where everyone thinks, feels, and does the exact same thing every day. People are caring for their loved ones for different medical reasons. It affects them differently. There are similarities, but things can be different. And so I really, actually, through working with this program, have been inspired a lot just by the strength and the resilience and the compassion and the love that the caregivers show, not only for their loved one, but typically they exhibit that to a lot of people around them. They've been caregivers for their community for a long time. So I've really enjoyed being a part of the program. And I appreciate y'all inviting me here. And hopefully I'm gonna go through the PowerPoint. I'm gonna go through pretty quick, but mostly that's just because I get nervous in front of crowds, and also because I want to make sure we have plenty of time for specific questions or anything I can go more in depth in, because I want this to really be as beneficial to the participants as possible. I do have some other coworkers. I believe I saw their names flash. So if anything becomes too much for me, I know they'll jump in and take over as often they do when I don't do something that they like. So we'll see how it goes. Are there any concerns before we get started? Can everyone hear okay? Is there any communication issues, or everyone on video? Good, see some thumbs up. All right, here we go.
And they all have the ability to unmute themselves. So
Okay.
if there's a question, or if you know, anybody you work with wants to chime in, they just can unmute themselves and they'll be able to communicate.
Now my coworkers for sure will chime in. You just guaranteed it right there. Yeah, no, I appreciate you saying that. Yeah, so caregivers, if at any point you want me to go back over something or repeat or go more in depth, I like interactive presentations. I don't like just talking for the whole time. So please don't hesitate to stop me at any point, and we can, you know, discuss things further. And here we go. So Caregiver Support Program. Here's some caregivers. there. Oh. All right, so the mission of our program, we talked about it being one of the few programs that's really geared towards caregivers, and that's what the mission is. The mission is really to do whatever we can to support the caregiver so they can continue to provide the best care possible to their loved one. It took a while for the medical community to catch on, but they finally did and realized that the person that can promote health and well-being the most for any patient really is the people that are closest to them. And so, you know, finally, after a lot of hard work from caregivers, you know, there's started to be more recognition of that fact. And so we really see that we can keep hospital costs down, emergency room visits down. We can really keep the patient or the loved one, the veteran, living in the home comfortably, safe, if we give the caregiver what they need to be supported. So that's that's really the mission. So for VA purposes, but really this is for, like, I guess, all purposes, a caregiver that we look at is really someone who identifies as a caregiver, and they provide assistance to another person, and in order to remain in the home. And this caregiver can be a spouse, it could be a significant other, parent, a child, a brother, a sister, cousin, nephew. Really, it could be even a next door neighbor. I can think of several situations where someone that didn't really know the other person until they, moved in the neighborhood, and then next thing you know, they're like the main support system for that person. So, caregiver encompasses a lot of situations, or can. So at the VA, we have two distinct programs. The first is the comprehensive program. And what I'm going to do is I'm going to talk about what it is currently, and then towards the end of the presentation, I'll share some changes that are going to be coming down that are going to look a little different, but that hasn't happened yet. So we'll talk about how it is now. So currently for the program of comprehensive assistance, if a person is approved for the program, the caregiver gets a monthly stipend, which is an acknowledgement of the services they provide. It does only include veterans that were seriously injured in the line of duty after September 2001. And there is it's a more rigorous type program. So the application process is pretty lengthy. There's a lot of assessments that have to be done, but with that comes more benefits. So we do home visits, we're monitoring progress. There is the stipend. You can get, the caregiver can get health insurance through Champ VA if they don't already have it. They're afforded mental health at no cost to them, either at a VA facility or contracted through the community. So it's definitely a more involved situation. Then we have our program of general caregiver supportive services. This one is I say more open. It doesn't have as lengthy of an application process. It doesn't include the stipend. You wouldn't get the insurance, the health insurance, although we could help try to refer you to a place. It's just not part of the program. There isn't an application, formal application that's needed. It includes all eras of veterans, so it doesn't necessarily have to be post 9/11. It could be anything from Korean War, World War II, all the way up until 9/11. And I'm gonna get into that just a little more detail on the next couple slides. So for the comprehensive program, I'm not going to go through. This is just a brief snapshot of criteria. I'm not going to get too into it, but it does have to be suffered or aggravated a serious injury in the line of duty, and that's after 9/11. And when they say injury, they really do mean injury. And so we don't consider illnesses, diseases, even if a person's service connected for it. It has to be linked to a specific event that was serious in nature while on duty. For caregiving, we're looking at specific caregiving tasks. So for a physical condition, we would be looking at activities of daily living. So they need daily assistance with bathing, dressing, grooming tasks, feeding, literal, feeding. And then for psychological, it would be safety and supervision. So, for veterans that are suffering from hallucinations or delusions or psychotic episodes, suicidality. So, more higher severity things. And of course, they would need to agree to receive care at the home, which just kind of means that they're not on their way to like a nursing home or another facility, but they're going to be in the home. With that, the services for the comprehensive program, like I said, they have the stipend, CHAMP VA healthcare coverage if they don't already have it. They get kind of extended respite services, and we can talk a little bit more about that. All eligible veterans have have an option if they meet the clinical criteria for respite care during the year. If you're in the comprehensive program, it would be extended. The mental health services, there's all kinds of trainings, educational opportunities, support groups, community programs. We do quarterly visits by a social worker and a nurse. We really, the relationship is more formal. So it's just more of an ongoing kind of support net. That for as long as you're in the program, there's going to be these regular visits. So someone's going to be checking in, and you can always call us outside of that. We're always available for that. And then just real basic on the general caregiver program. So it's all eras of veteran. Really it's supposed to be activities of daily living too, but we really want people to participate in that program. So we'll look at a broader area of caregiving. So if a person is, maybe they don't need help every day, but they need help kind of on a regular basis with activities of daily living, we'll look at that. This can also encompass illnesses as well as diseases and injuries. So it's not limited to injuries. And the safety and supervision can be things like wandering or, confusion, not being able to follow directions without someone, spelling it, each step. So it's just kind of a broader group. They too have access to all the education, the trainings, the support groups. They said they get up to the 30 days of respite care. We can help them facilitate treatment with other programs. This one's more informal. There's not the home visits that are scheduled. However, we have met with general caregivers in the home if they request it. So it's really kind of an as needed. Most of the time what happens is the general caregiver will call and say they're having an issue, or they heard about something, they want more information. We've got 7 social workers and going on 5 nurses that are, ready, willing, and able to provide whatever assistance, get them connected with the right people, help mediate or negotiate, not really negotiate, that sounds like a weird word, facilitate treatment, options or explain things. And there's just a list of some of the things there that I've mentioned. Operation Family Caregiver, the caregiver support line is really popular with our general caregivers because they essentially the hours are more expanded than what we normally work. So in the evenings, a person would be able to call and talk to a social worker, get questions answered, support, and then it gets referred to us, and then we'll follow up again usually in a day or two and make sure every question was answered. A lot of people use the support line. We also do education calls on that each month. It's a different topic, and you call in, there's a presentation, and then you have a chance to ask questions. They go over things like self-care, the difference between enabling and helping, just a variety of topics. The support groups are pretty popular. Support groups we've typically done in person, but thanks to our friend COVID, who is not our friend, we've started doing more Video Connect groups, and we've had a lot of really good turnout with the Video Connect. One of the things that caregivers have expressed to us is that it's difficult to get away to go to a support group, and we don't provide, we don't have an option at the group to care for the patient. So the Video Connect has been really, and so I think what we're going to do is maybe augment our in-person to include the videos, so people can come in person if they can, and if not, they can video in and still be part of the group and get that community feel. So I've talked to a couple of the other social workers that have done that, and it seems like they're pretty excited about that possibility. So we're hopeful for it. We see the Operation Family Caregiver, the Reach VA. Both of those are kind of like a coaching, where it's a kind of a program. There's I think for both of them it's 4 sessions. You go through kind of a set amount of topics depending on what your loved one is dealing with. And so for instance, they have a Reach program for dementia, or they have one for ALS, or one for let's say dementia, Alzheimer's. So it's kind of geared towards the specific ailment. So those are really neat. And we have to do the Reach VA, you have to have a provider that's been certified. And so at our facility, we actually have several that have gone through that certification. Some sites don't have any. Not to brag on Central Texas, but yeah, we have several that are certified in that. So pretty nice. And okay, so that's actually, just don't look at that. So that's kind of the current situation. This slide is going to talk about what's coming down in a few months. But before I go on to this, is there any questions about kind of what I just went over? Is there anything I could talk more in depth about, or anything specific? No? All right, must be fantastic presentation so far. So this next slide, so the Mission Act. So the Mission Act was signed in 2018, I believe, and included a lot of things with regards to caregiver support. One of the big wins from the VA caregiver support side, the caregiver side, veteran service organizations, everyone really wanted this to change. And so Mission Act did it. We're real excited. The comprehensive program is gonna expand to all era veterans. And so there's kind of 3 things that have always kind of plagued our staff, but also our families, our caregivers, the veterans. And one of them was, someone needs a caregiver, they have a caregiver, they've been seriously injured or ill, they're struggling, and they would meet criteria for the comprehensive program, all the different criteria, except they're a Vietnam veteran, or except they served in the 80s. And it's just, it never gets easy to say it, and it's certainly never easy to hear it. And so what's going to happen is around October, phase 1 is going to be implemented, and phase 1 is going to open up the program to veterans that meet all the other criteria, but they were injured in the line of duty prior to May 7th, 1975. So it's basically the Vietnam and prior. And then and still include the post 9/11 as well. And then after that rollout, as of now, a couple of years after that, so looking at maybe October 2022, we're going to open it up to everyone else. And so at that point, any era veteran will, the comprehensive program could be an option. Again, there's other criteria, but that's a big part of it. And so we're real happy that Congress passed that and made this happen. And we're really looking forward to it. We've been waiting for the computer system. The the new computer program that we're using to get really up and running, and it's doing well. So right now it's basically just getting it certified, finalizing everything, and then we'll be able to roll that out. And so there'll be a lot of promotional stuff. The veteran service organizations will put things out. The VA will put things out in the media. And of course, we're going to put stuff out to other providers and stuff so that they're aware when that happens fully. And, okay, so this is something that we recently started. A nurse that joined the program from another site started this, and so I just wanted to share this with you, just so y'all know some of the things we're working on here at the VA in the caregiver program. So what we're starting is this program council that's really going to help us reach the caregiver, help us reach caregivers, help us provide services that are appropriate, that caregivers want, that they need. It's going to make sure that it's going to help us to better coordinate and plan with outside agencies. Really, honestly, the VA is huge. Even in Central Texas, there's programs and providers that all the stuff that we do, there's so much turnover or whatnot that there's people here that aren't aware of the program. And so this is going to help us make sure that providers are up to date. They understand what's going on. So we're excited about this. And we have representation from Alzheimer's Association. So we're really happy with that. And we're looking forward to the council. I think it's going to do a lot of good for caregivers. And that one, yeah. And so this is our staff. And so it's actually on the informational. It has contact information, has our address, office number. I think the sheet I sent you, Shannon, I believe it has our individual phone numbers, but even if it doesn't, at that main number, they can patch you through to whomever.
It does have your numbers.
It does?
Mm-hmm.
Good, yeah. And so those are our work cell numbers. So we're community social workers. We're usually out and about, and the cell, well, we know how cells are. That's usually the only way to get a hold of anybody these days, actually. But yeah, so definitely feel free to use those. We all have confidential voicemail, or most of us anyways. So, if you happen to get the voicemail, leave us a message, let us know what's going on. And when we call you back, hopefully we can already have an answer or information or whatever it is you were requesting. Now I did want to share, so it's not on the slide, and I'm glad it's not, because nothing is finalized, but I do want to share with everyone some of the things that could potentially take effect around the time that Mission Act expansion takes effect. So there's been some proposals from the VA Caregiver Support Program to Congress to change some other rules and criteria as well. And so it was just on the sort of Federal Registry website. They were taking commentary from caregivers and organizations. But some of the key features, if it goes into effect, earlier I mentioned there was 3 major things we really wanted to change with the criteria. The Mission Act did one. Well, these proposed changes are going to take care of those other 2 main areas. And they are that it's no longer, if it takes effect, we would be able to consider illnesses and diseases as well as injuries. So for all the people that were in the line of duty and developed heart disease or or MS, of course, maybe early stage Alzheimer's or dementia, whatever it is, we'd be able to look at it. And the other key thing is we would no longer have to match the caregiving with the eligible condition. So we have a lot of older veterans that are service-connected 10% for hearing. That's all they ever put in for, but they have, a whole list of ailments that they need care. If that individual meets all the other criteria, we wouldn't have to match the caregiving with the hearing. We would be able to match, they call it decoupling. So essentially, they just have to meet the eligibility and require caregiving. We don't have to match the caregiving to the eligible condition. So those were the kind of the other two things. And that's going to really open it up to a lot of individuals with the comprehensive. And so, like I said, I mean, it's always been difficult. And so I think a lot of people are going to really have access to this and get to benefit. But yeah, so that is all of my spiel. Are there any questions?
Cory, thank you for going over all that. One quick question. You mentioned that they're going to be working on going in the future to decoupling. So if someone meets the criteria, like the example you gave for hearing, when will that start taking place?
Well, right now it's still a proposal. So they went through the comment, they went through the comment period, and they've reviewed that and made adjustments where they see they need to make adjustments, or not made adjustments if they didn't think adjustments were needed. We're waiting on finalization. So Congress is going to have to sign off on that. The hope is that it would roll out the same time as the Mission Act expansion. So around October, that's what we would hope. So any changes we hope are going to come then. But obviously, those things are so desirable that, you know, we'll take them whenever they come out. And but the hope is that it would roll out the same. Again, that's all tentative, but we had a lot of good comments from caregivers. A lot of people are really on board with it. So it'll just come down to however Congress works to decide if they want to do that. Yeah, so nothing in stone on that. The Mission Act portion, expanding to all eras, that has already been decided. We're just waiting on that for a go, but that's gonna happen. It's just, they're shooting for October. Maybe it'll be earlier, maybe November. We'll just, you know, we'll have to wait, but we'll put out info when it does.
That's great. Thank you for that.
No problem. Any other questions or comments, concerns, situations? And also, our job is to be not only kind of the local kind of expert on caregiving, or caregiver support services, but we're also, you know, really encouraged to get knowledgeable about other programs and services. So if anyone has any questions about another VA, something else VA, you know, we're more than happy to answer that. While we're here, you know, might as well answer what we can. I just really want another question. They say, be careful what you wish for, right?
Well, I know you were going to elaborate a little bit on the respite. Maybe after this question, you can do that.
Okay. So someone had
I just had a quick question. I don't know if it's quick, but if somebody, like a family member or a veteran themselves, they're interested in applying for the aid and attendance services, what's the best way to start that process? Or are there supports in the community that can help with the application itself?
Yeah, there are. So with anything at the VA, applying for anything at the VA, any program, services, whatnot, all of that is, of course, free. But VSOs, Veteran Service Organizations, are the ones that are actually get grants and get financial support from the government to help people apply for the various benefit programs and such. With regards to aid and attendance, yeah, it's an application. It's the VA 21-2680. And essentially, the first portion is just regular demographic information, address, name, phone number. Then the rest of it is a sort of a clinical exam that needs to be completed by the veteran's provider. It has to be a doctor. It doesn't have to be a VA doctor, but it does have to be a prescribing physician. That form would then be sent to the regional office where your claims are handled. So for Central Texas, that would be Waco. the VBA that also does the VA disability, they would review the form, determine eligibility, and then send you the results. Again, you can do that on your own. You can download the form offline. You can coordinate with your provider, get it completed. You can fax it or mail it or hand deliver it to Waco, or a veteran service organization like Texas Veterans Commission, Disabled American Vets. You know, there's a whole bunch, VFW, there's a county service officer, you know, a whole lot of options. They can also help you walk through the process, kind of take a look at the form. Now, I mentioned the word free, and I wanted to point out that for anything at the VA that's free, there are going to be companies that you'll find online that will charge you to do the same thing. And I like to share it with people because people often don't know until they do it, and then they realize, oh, wait a minute. Like, I didn't have to go through an agency and pay 20% of the, you know, of the fee or whatnot. So yeah, there are agencies, they promote themselves as usually veteran owned. And I don't want to sound like I'm talking negative, because I'm not. I'm sure they've helped thousands of people. But there are agencies, they'll help you with the process. They specialize in it, so they know the ins and outs and stuff. And then, yeah, they'll charge you usually a percentage of the back pay, because it's retroactive to the date you claim. And so sometimes it can take up to 6 months before you're approved. So you would get that aid and attendance for the previous 6 months. So they'll take a portion of that. And then sometimes they'll take a portion of the monthly amount. And what they do is they say they're going to help coordinate using that money to get care in the home. So like if you have a home health agency that's coming in, they'll coordinate with the home health agency, and for that coordination fee, for that coordination, they'll charge a fee. But definitely, if you come across anything, for sure, that's a great question. Give us a call. Again, there has been some people that they don't have the time, the energy, they don't feel like messing with it. And so these agencies that you have to pay a little bit to, it's a godsend. And then there's other people that definitely could have did it themselves. They didn't know that they had that option. They pay and then they kind of regret it. So yeah, great question. And if you have other, want to talk about that one further, give a call. But yeah, the form is VA form 21-2680. You have to already be getting VA benefits, either a pension or compensation. But again, that's getting into the weeds. I can talk with you, offline, get more in depth if you would like.
Thank you so much. Yeah, I appreciate that. I work with patients whose family members are oftentimes interested in applying, but sometimes can be kind of overwhelmed or not really sure how to kind of navigate it, even though the form itself is pretty straightforward. I think it can be overwhelming at times. So thank you so much.
Big time. Yeah. And I'm glad you said that, because I think sometimes, I even fall into the trap of where I see I work with these forms and the VA and stuff. And so sometimes it's like, oh, all you got to do is, like it's so easy, but then not, it's easy to forget that, not everyone does it all the time. And even though it seems kind of simple, knowing where to take it, who to take it to, what it's called, that all is very confusing.
Exactly. Thank you so much.
Have any of your patients, if they ever have them call us. We're more than happy to talk to them one-on-one.
Thank you so much.
Good question.
I have a question about the VA aid and attendance, about the qualifications for that. Did you say that the veteran has to already be receiving benefits in order to apply for the aid and attendance?
Yeah, so it's like an add-on benefit. So think about it like you can't get HBO unless you're getting cable already. Like they just don't give you HBO. So aid and attendance is kind of the same thing, where you already have to be getting some form of compensation, either through VA disability or be getting a pension, which is still a disability, but it doesn't but it means it's not necessarily service connected, but because of some other factors, income, when you served, had to be during a wartime era. You'd be allotted a certain amount of money each month to kind of bring you up. Now, that's not to say that a person can't apply for both at the same time, because you can do that. So if your loved one just has never applied for anything before, but aid and attendance seems like it might be an option based on what's going on, what would be encouraged would be to file an initial claim one way or the other, either for pension or compensation. At the same time, apply for aid and attendance. And then if you're awarded the one, you might be able to get the other as well. Is that, it's kind of complicated.
Well, complicated. Okay, so aid and attendance can be a benefit for a veteran who did not serve as a career veteran, just
Yeah, good
Or-
question.
4
Yeah,
years
so-
during Vietnam.
Not even, I'm sorry to cut you off. I get excited
I
about
was,
answering questions. Okay, so yeah, the question, so do they have to have served a certain amount of time or during a certain time period? So for aid and attendance, not necessarily. The main thing is they have to be getting money from the VA. So for VA disability, a person could have only served 3 weeks in basic training. And if they were injured and they get approved for service-connected disability, they may carry that disability check the whole rest of their life. They've only served a few days. So definitely it's not necessarily geared towards like you have to have been in combat or the part that gets confusing is when the community talks about aid and attendance, they talk about it combined with VA pension. VA pension does have specifics on when it had to be during war, it had to have been a certain time frame, I think 2 years, with at least 1 day being during a wartime era. The income has to meet a criteria. They have to be considered totally and permanent disabled, even though it's not connected to service. So it's a little more confusing, but the aid and attendance in and of itself doesn't have any of that. It's just what it's attached to.
okay.
It's
So disability benefits through the VA do not have to be tied to the service
they do have to be tied to service, but they
occurred during service?
yeah. So the compensation, there's the two things are compensation and pension. Compensation, both of them come from the disability office. Compensation has to be connected to your current condition, has to be connected to a condition that was caused by or aggravated by military service of any kind. So stateside, I was active duty, Navy. I was walking across the street and I fell off a curb and broke my leg. That potentially could end up being a compensation type claim. Yeah, so for compensation, which is what most people say when they say VA disability, they're talking about VA compensation. That could be for anything. Just it has to be related to while they were on service.
Okay.
Basically, connected in some way, even secondarily connected.
Okay, thank you.
You're welcome. It's yeah, it's the VA. That's a really good question though. And again, with that, I'm available to go over it more to try to get that explained.
Cory, we have a question from Roberta. The question is, will Cold War veterans be eligible for benefits? And he has hearing loss and receives disability compensation.
Okay, so as far as, they're talking about the comprehensive program, I'm guessing?
Yeah, I think that was probably because it came originally when you were talking about that.
Okay, so with regards to the era of service, Cold War will be included on phase 2. So phase 1 starts, that's going to be Vietnam and prior. Phase 2, which will be 2 years later, is going to open up to all eras. So that's going to include Cold War. Now, as of now, hearing, if the current criteria stays the same except for the time of service, hearing usually isn't considered an eligible condition. But if it is connected to a serious injury and not just like repeated exposure to aircraft or ships or planes or whatnot, or tanks, if it was an injury, you know, shrapnel hit the ear, then we would still have to show that the individual is in need of caregiving ADL assistance because of the ear condition. So, you know, I guess in some cases, maybe if the hearing was so severe that it affected their ability, well, it could like balance. So like if it was real severe, or maybe their balance was messed up and they couldn't bathe themselves safely because they maybe fall, you know, out of the chair or something. Yeah, some kind of, yeah, so that potentially, but as of now, in answer to your question, yeah, Cold War will be included in comprehensive. Yeah.
Good, thank you.
Thank you. Is that any others? Can y'all see my crepe myrtle in the background? I tried to make sure it was there. I don't know if it's too bright, but I'm proud of my crepe myrtle. It was like that big when I planted it 6 years ago. Things grow. All right. So if no other questions, respite, I think we wanted to talk. So anybody that's eligible for care at the VA has, administratively, they have 30 days of respite per year that they can use. For that program, the veteran has to be the care recipient. They have to meet clinical criteria, but if they do, they get up to 30 days a year of respite services. That can be one of two ways. It could be in-home. A 6-hour, I guess, period is considered a day. So you would get 30 6-hour slots or, you know, days. Or it could be inpatient. So for instance, a caregiver, a family thing comes up and you got to travel in a couple of months and be somewhere, and you just got a lot of stuff to take care of and you really can't take your loved one with you. We would be able to potentially put them at one of our contract nursing homes for overnight care. And there would be 30 days of that as well. And it's usually no cost unless you happen to have a copay at the VA. And then a day would be whatever your copay is. So, you know, $25 a day. Most people don't have a copay, but some do. Now, the clinical criteria is kind of extensive, but essentially they require ADL assistance. It doesn't have to be for a service-connected condition, but they do have to require ADL assistance. Have some kind of severe neurocognitive disorder, dementia, Alzheimer's, something that affects their ability to be safe. Or they could maybe need a combination of some ADL assistance, maybe not a lot of ADL assistance, but a little bit, and they're over at the age of 75. So there's a lot of caveats. That goes through primary care. So the veteran's primary care physician, that's who you would talk to about it at the VA, and they would put in a consult to our respite care program. And then that coordinator would call, do an assessment, and then kind of talk more about how that works. We use community agencies. We partner with a bunch of home health agencies. And so we would, if approved, we would try to find one in your area that's able to staff what you're needing and have a trained attendant that would come in, keep your loved ones safe while you go handle, run errands, a nap. I've had caregivers that use that time to have like uninterrupted sleep. So it's a lovely program, and it is 30 days per calendar year, and each calendar year it just replenishes. So it's an ongoing thing.
And Cory, you said this is for Central Texas. So if someone that's like in Cedar Park or in Kyle, would they be able to use these services too, or do they have to go to a different VA or contact a different person?
So for which a particular service or just in general?
Just in general, like what you're talking about, either to use any of these caregiver support programs that you're talking about.
Okay, yeah. So really for everything we've talked about so far, wherever your catchment area is or whatever area you go to is going to provide that. So it's, like with caregiver support, we have caregivers that are in our program in Brownwood, in Palestine, College Station, all over Central Texas. And so we go wherever they are, so there's no place you have to be. For like respite, it just goes through your primary care. So if a person lives in Kyle and they happen to go to San Marcos, which is South Texas, they would just go to their primary care there. If they live in Kyle, but they come to Austin outpatient, they would just talk to their provider there. It's our job to kind of try to find an agency. If people live in a different catch, sometimes it can be a little, could be some roadblocks. If someone lives in San Antonio, but they decide to come here, that's fine. But our agencies don't always, sometimes they don't have the same HR, the same billing departments. And so it can be hard to find one in San Antonio that works with us because it's a different region. But again, we try to make it work, and it has worked. It just adds a little complexity sometimes, but really just wherever they go, we provide them that care. But it has to be through the VA is the only thing. Yeah. Did I answer that?
Yeah, thank you.
All right.
Well, this is
I don't
so
see
informative. Does any of your partners that you work with have a question or a comment?
I think I saw Kelly. Kelly, did you have anything you want to add? Or Dilcia, I think, might be on. Marilyn.
Cory, you just did an absolutely stellar job.
Thanks, Kelly.
Did you see? I clapped for you. Did you see that?
I can't see. Oh, I see
There
you
you go.
now. Oh, that's the hand. Oh, thanks, Kelly. All right. Absolutely
a great job. Well, I really appreciate this. This is just great information. It answers a lot of questions, and I'm sure, with everyone listening, you'll receive this copy, and then I will send you that handout that will have the phone number so they can reach you directly.
Oh, good.
Questions. And then, again, this is why we do what we do. We want to make sure that caregivers know about all these different resources and supports and opportunities. I myself didn't know about this program, about a year ago. So when I found you, I was like, tell me about it. Tell me more. I'm sharing your information. And every chance I get, I share about this program. I even share it with my own family, with my own father. Taking notes too, because I have a Cold War veteran, as my dad. So, I'm taking this also. So it's very informative. If you don't need it now, but need it later, it's a good tool to have in your box. So thank you again. I really do appreciate it. We continue to have these, Cory, every month. So if you, to anybody you talk to, they can come visit our website. And we're doing this all summer long. And this is one of our responses to COVID that decided to try to find a way to reach out to caregivers in our community and by spotlighting services that people can know about a little bit more and about them. And so next week we're going to have Baylor Scott and White come out and speak to us. So that will be a good one if anybody's interested in learning about how Baylor Scott and White works and their industries. And I think they're going to talk about strategies, caregiver strategies, working with dementia caregivers as well. So they'll be presenting, but you can see our whole list. So if you want to share that with anybody you speak with, it's just a 1 hour at 2:00. We'll be doing that all summer long. We'll still do some presentations once a month to reach out, and we're just trying to find ways to meet the needs of the community during this time. And this has been one of the best ways that I've seen that we can connect people with the right services.
Okay. Yeah, no, I appreciate it again. Thanks for thinking of us. And yeah, I definitely would like to check out some of those other presentations, you know, and talks and stuff. So yeah, it'd be good, I think, to have a representative there just to get some of that info and share with our caregivers. So
Yeah, absolutely. And if
Right.
there's some that you've seen that have already passed, we do have they're all pre-recorded like we're doing this one. I mean, not pre-recorded, they're all recorded. So we can always send that to you, especially if somebody, you know, that you might know, like, oh, they're needing an elder law. Like we had that last week.
Oh,
I just sent that to somebody yesterday because there was a question. I was like, here, let me send this to you. This might be a good little research, you know, while you're looking.
yeah.
Definitely have questions about Medicaid come up. So we had someone speak about that as well. So definitely reach out to that. Let us know if there's anything, again, you need from us. And we're here.
All right. Awesome. Thank you, Shannon. And thanks everyone for participating, and great questions too. And again, just reiterate, if you're not sure about something VA related or caregiving related, you know, we're here, and we've got a lot of people, and it's our job. So it's never, no question is too small or too complicated or anything. Like we want to help, you know, so. All right. Thank y'all.
Thank you very much. Y'all stay safe and well.
Yep. You know.